Hi, my name is Jane. I'm from Advanced Aesthetics, located here in King William Road in High Park. How are you today, Rachel?
Great, thank you.
That's good. Dr Gronke is a cosmetic doctor and has been for the last 20 years, and I'm very lucky to have her in my clinic part-time, a couple of days a week. So Rachel, tell me a little bit about yourself. So with your background, you had your own clinic there for a while in Melbourne Street, North Adelaide.
Yes, I did. I come from a background of general practice. I've probably been a GP for over 30 years now. And about just over 20 years ago, I went into cosmetic medicine, primarily as a sclerotherapist or an injector of leg veins.
Yes.
And then loved it so much that I ended up buying my own clinic about 10 years ago. And during that time, I did a lot of upskilling. So I achieved my fellowship with the College of Aesthetic Medicine and also my full membership with the Cosmetic Physicians College. So I am now technically a cosmetic physician. But in that time, obviously, I involved myself in many different treatments, like involving lasers, treatment of red veins, of faces, removal of lesions, treatment of pigmentation, treatment of for hair removal, and in addition to my leg vein treatments.
Excellent. So we actually have our skin consultations in our clinic when you first come in with Rachel, and also we do skin health checks for skin cancers. So that's very important, isn't it, Rachel?
Absolutely, especially given that we all are happy little Australians here, and we live in a very sunny country. The sun damage that we all experience is quite significant. So yes, skin checks are mandatory.
In fact, I think 1 in every 3 Australians is diagnosed with skin cancer during a lifetime in Australia, so we're very high up there, I believe.
Absolutely.
Yes, with our rates of diagnosis. So how often would you suggest that someone should get their skin cancers checked?
Depending on your sun exposure over your lifetime, whether you had a lot of severe sunburns as a child, or as a teenager especially, whether you've been a sports person and done a lot of outside activities. Some of us live in a bubble and very rarely get sun exposure. So generally I would say every year, if you've had significant sun exposure, especially after 40.
Okay. It's good to know.
Yeah, it would be a good time to start getting more regular checks if you
so
haven't.
So 6 months maybe, or?
No.
12 months?
At least 12 monthly, and certainly act on any abnormal skin spots that you notice over that time. Getting some medical eyes on them, certainly it does you no harm. And
you would actually then get a second opinion if we were to find a cancerous...
Yes, I'm not a dermatologist,
yes.
So I would always, if there was a lesion that I felt I could handle, then I would certainly treat it. But if there was anything of more concern, like a significant skin cancer, I would refer immediately for biopsy or removal.
Yeah. That's fantastic. Thanks, Rachel. Also, you do other skin analysis to address any other skin concerns, like acne, etc., which is quite popular, I imagine, or common, I should say.
Well, generally, as your skin consultation revolves around the major skin concern that the patient presents. So you would, and we do tend to just look at skin. And that's the first thing we notice about a face that walks in the door. So you observe the colour, the texture, the tone, any blemishes that might be there. So that's all part of your skin analysis. We then look into skin type, degree of sun damage, degree of wrinkling, and generally whatever seems to be of primary significance to subsequent treatments that might be necessary.
Okay, so then you can also prescribe us any creams, topical creams, that type of thing.
Certainly, the skin management is going to involve both medical grade skincare and cosmeceutical grade skincare, as well as sun protection.
That's fabulous. Well, that's all we have time for today, so thank you, Rachel. And once again, if you'd like to make a booking, come in and see Rachel, give us a call on 8272 6000. Bye for now.